Welcome back to Valley Life. I'm Alicia Safias. Today we are at Clinica Sierra Vista, and I'm joined by CEO Steve Schilling. Welcome.
Thank you. Thanks for coming.
Now, first of all, we are standing in the dental health facility, one of them. But first, give us an overview of Clinica Sierra Vista.
Well, Clinica Sierra Vista is a community health center system serving Kern, Fresno, and Inyo County. We have been up here in Fresno since 2008, down in Kern for 41 years. We're now today the second largest community health center network in the nation. We operate about 35 medical facilities and 6 dental facilities, and we're standing in one of those up here in Fresno, our newest and most modern and largest dental facility.
And as you can see from the video, this is very high tech. I mean, you have a very high tech center here, and you just opened it. I know you're very proud of this.
Well, this is state-of-the-art top. This is really top-flight equipment, wonderful staff. 9 operatories. We have 9,000 square feet out here on South Elm, and we're trying to serve the underserved and uninsured and moderate to low income population of urban Fresno. And as you can see, the business is booming and we're getting busier by the day. Started out with one dentist a couple of years ago, and we expect this thing to just keep exploding, and the need for oral health services is immense.
We're talking about pediatric dentistry, and you just told me something that was staggering to me, a very disturbing statistic in California.
Well, the most common infectious illness of children today in California is dental caries, or poor oral health. It impacts their ability to stay in school, to do schoolwork, to attend daily, to sit and concentrate, and to study and learn. It also affects their physical health in a lot of variety of ways. And it also, untreated, becomes just a horrifically expensive public health concern, damaging their smile, their ability to seek employment later and to prosper in life. So accessing early prevention and getting into early care and coming in for routine visits, particularly in places like this where you can get in and you can be seen with or without your coverages, is really essential to the well-being of our community going forward.
And give us an idea, because I think a lot of families out there believe that they can't afford dental health, especially for their children and their families, but you are open to the public, and you have a sliding scale, which is something that's very unique. Explain that to us.
Well, beyond having a sliding scale, we also accept Medi-Cal and healthy families, and most kids in California, those that don't have private insurance, most children are going to qualify for one or the other of those programs. We also have people here on staff who will help you qualify for those programs, will help you do the paperwork and move that paperwork through the system to get you that coverage. But should you not have any of those eligibilities, or you're just between and you're not able, we do have sliding scales based on your income and family size that we can make available to you, and your dental charges will be adjusted based on either a 25, 50, or 75% reduction in the gross charge. So although there is a fee, it's not totally free. There's no free lunch anyplace. It's very affordable, and you can bring your kids in and they can get the hygiene and the preventive care and the prophylactic care that they need.
I think you made a good point. You talked to us about paperwork. That's something that's very intimidating to a lot of people. If they don't feel like they qualify, they're not sure what to do, but you actually have the staff to work them through that process. So what can people expect when they come in?
Well, they need to bring along information about themselves and their family and their children, a copy of their birth certificate or information about their address and some confirmation about who they are. We don't really get into a big deal about your status here, but you need to show us some evidence of what your family income would be. Certainly bring along your insurance card. We take those too, and your Medi-Cal card. Just need to bring along that kind of paperwork with you and your children, and come on in, call up for an appointment, and we'll get you in.
And it doesn't have to be intimidating. I saw 2 twins walk in here. They both have smiles on their faces. They're both getting their cleaning. So it really is a friendly atmosphere.
Yes, it is. We really focus particularly on kids. There have been a lot of changes in California in the last few years where adult dental services have been really restricted. So lots of dental providers have been really purposefully intending to focus a lot of our professional work on kids. So we've really been working with our staff and our facilities to make sure they're child friendly, and we know how to deal with kids. And kids are not the easiest sometimes to work with in the dental environment, but I think our people do a really great job of it. And as evidenced by the massive outpouring that we're seeing here at this place.
And it keeps growing.
And it keeps growing, and we expect it to keep growing. Yeah.
And that's evidenced by the kids walking out of here with the big smiles on their faces. Thank you so much for joining us.
Thank you for coming.
Again, you can call into Clinica Sierra Vista. The staff can work you through the process, and again, state-of-the-art dental facilities right here on campus. And Valley Life will be right back.